Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors Good Medicine Docu-Series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Kick COVID-19 to the curb. The go-to guide for fortifying your immune system and winning this germ war by Drs. Angela Akey and Kathleen O'Neill Smith, also known as the FIRRIMup Doctors.
This is beautifully written. I think it is lively, simple, easily understood, and interesting. It seems to me a useful publication and a beautiful tribute to those you collaborate with. E.H., Comparative Literature Professor and Patient.
That was an endorsement and a patient review by one of Dr. Akey's patients and who is also a literature professor. And as you can see here on the screen, this is their new guidebook, Kick COVID-19 to the Curb. You can purchase it on our website, which is right here, FIRRIMupDoctors.com. Right on the homepage, there'll be a button to lead you to buy the paper book. And there's also a Google Play option where you can purchase the ebook version. Now, without further ado, I'm going to introduce our FIRRIMup doctors. We have Dr. Angela Akey and Dr. Kathleen O'Neill Smith.
Hi, everybody.
Hi, everybody from Boston. Happy Thursday.
Is the weather better up there now, Dr. Kathleen?
It feels like Florida.
Oh,
it's humid and hot. It's fantastic. I love it.
That's great. It's better than cold, right?
Absolutely. Absolutely. You know, it's so interesting. I mean, I think one of the things about this whole COVID thing is that one of the things that I thought early on, and I think you agreed, is that we thought that this bug loved the cold more than anything because it was here. So it's interesting to think about how did it spread 3 months later from the Northeast and be so rampant now in Florida.
Florida and Texas, right?
Yeah,
we're very, very, very hot.
Yeah, California, you know, it's a desert. So it's so interesting to think about that. And I think that it really is about, everybody did such a good job, you know, kind of sheltering in place. And it's hard to keep doing that though, right? It's hard to keep doing that. The COVID fatigue sets in. And then what happens? We all get together not realizing. So I think Florida is still a better climate. I really do. I just think it happens to be that, you know, it's a good place to be with other people.
Exactly. And the ultraviolet does kill the virus. So being, you know, it's better to be outside than inside, but not congregating even outside. Right. So let's take a peek at what's happening. So here we were back in March. You were getting hit in Boston, March and April. And it wasn't busy at all, but look at us now. Next slide. So here we are, Eastern Seaboard, Western Seaboard, Florida and Texas, hotspots, just like California, but definitely an uptick even in our own regional, my own regional practice. Next slide. Okay, so in the United States, we passed 3 million. We've tested 37 million, 132,000 deaths, and about 1 million have recovered. In Florida, we're busy now. 2.3 million tests, confirmed 224,000, hospitalized are 17,000, deaths are about 4,000. Alachua County is actually doing very well still, however. I did look it up. Our largest hospital has ICU bed capacity of just over 300. And as of yesterday, there were reports that we're using less than 5% of those. So in terms of capacity, we still have a lot of capacity. We've just had a lot more positives. And so even within our own practice, we've had a lot of telehealth on exposures and sick people and positives. So in Alachua County, 1,792 are confirmed positives, 12 deaths. In my regional practice, North Florida Integrative Medicine, we've done 97 serology tests, 4 are positives, 3 IgG and 1 IgM. And total positive COVID swab patients have been 8 out of 6,000.
Mhm.
So far from herd immunity. Our patients have been so good about sheltering in. And I'd like to message to, we made it successfully over the 16 weeks to July 4th last week. But honestly, I would like the high risk people to continue to shelter in, the medium risk people to make telehealth conferences with us at least monthly, or if you're thinking about going back to work, let's have that discussion. And I think the low risk people are out there serving the community, but they have to be really mindful of physical distancing and wearing facial coverings and being mindful of the people that are at higher risk than them. But yeah, I found myself COVID swabbing again on Monday. So it was a reality check, Dr. Kathleen.
I know. It's such a reality check for all of us because we all had our hearts set on getting to a deadline, right? And I think the reality is that we've got to be adaptogenic. We've got to be resilient. We've got to, understand that this is a process and everybody, lives a little bit differently. So, I mean, in Boston right now, we don't have many hospital beds filled. Back in April and May, we were full to capacity with people even in the convention center. So that was early in May, mid-April to early May, and now that has dramatically shifted, and that's a beautiful thing. And hopefully we can keep it that way. I mean, it's hard if you hadn't experienced that to keep it that way, but it's worth knowing that it is happening and it is real, because I remember way back in March and April when I got calls from friends who are doctors, you know them as well, from our conferences, who were in Texas and California and Idaho, that didn't believe this was real because their ICU beds in April were empty. And, at some point it's just going to pass through as we go towards herd immunity. And I think that's the key thing to remember. Those graphs from March until today, July, they look like we're working towards herd immunity. We're not there, but that's what's happening. And so the good news is that there are a lot of tests being done. We're seeing that many people have positive test results, but the percentage of people who are dying is not growing. And
Yes,
that's
it's very low. Actually, I have some of those stats.
Yeah.
Yeah.
And really important to understand. It is important because we don't want anyone to die if we could have it our way, right? We want to minimize deaths if that would be our second choice, right? No deaths, then very few deaths. And then also the most important thing to think about it too is we don't want people to end up with what we call sequelae or chronic condition. We're going to talk about smell and taste and those things, and they can really take away your enjoyment of life, right? So I think it's really important to be thinking about, what could be the chronic conditions that we also want to prevent by doing our share, which the only thing we know that's really simple is putting a mask on, physical distancing, and washing your hands. That's what we have. It's not that complicated. If we do that, we're going to do a good job.
Yeah, especially consider staying home at this point. At least for our community in North Central Florida, we're getting an uptick. And so please stay home, especially if you're high risk. So in Massachusetts, we've looked at this before. You've had 8,000 deaths and we so far have had 4,000. So your peak happened earlier than ours. But at least it's looking like hopefully we're not going to overrun our hospital systems. Although in South Florida, I heard that there were 3 emergency rooms on bypass, but it's also the area where they're resisting wearing masks along the Palm Beach County area. So the Gulf, where my other family member lives, the Gulf, they're respecting the masks quite well, though. So
it's really important. We don't have any bars open. We will not open bars this year, I bet, in Massachusetts. And indoor dining, I would say that I know people who own restaurants locally in downtown, and very few people are indoor dining. So it's not a preference. Everybody's outdoor dining if they're doing that. And the mayor and the governor here are insanely strict, but also kids are strict. I mean, my daughter had some friends over last night and they wanted to be outside. They will not go in houses. They always wear masks. They bring their own food. They're very strict. And these are college kids.
I think that's great.
Mhm.
I don't think that's across the board though, about being responsible and strict. So hopefully that trend will increase. So yeah, what we're saying is it's not bad in Alachua County where Gainesville is. We've had 2 new hospitalizations since July 4th, and we've done a lot of testing, 4,603 negative tests and 547 positive tests. But look over there to the right, the Alachua County case fatality rate is 0.6%. And that's reassuring. So basically, if you get COVID, you have a 99.4% chance of being just fine. Right? That's how I'd interpret that. And that's a good thing. That's much better than Wuhan, China. So next slide. So we're going to move, we did the survey and we heard that we can move it to this time, but also to keep our webinars down to 30 minutes. So we're moving right into our frequently asked question. How do I regain my sense of smell if it's lost due to COVID-19? So loss of smell kind of is a flip side of loss of taste. And I remember you were saying that you had a chef with COVID-19. Tell us about her.
Yeah, no, I think that in my patients, loss of smell is, well, first of all, loss of smell can readily go because you can see from this diagram here, the olfactory nerve, the yellow, I mean, it's really vulnerable. It's right there. And then the little opening in the nose is down below. And it's pretty easy to have things come in there and to kind of challenge those little nerves. So loss of smell can be common, but with COVID, it's very, very common. And it's really important because it can disrupt how you feel. So it's one of the key symptoms, and it's something I follow. I don't see many patients or people, but if I thought I've been exposed and you get a little paranoid about it, I basically am always, can I smell, can I smell, can I smell, can I smell the coffee that I smell brewing whenever we're together? You make the coffee for me. And so I smell the coffee, can I smell other things? And that's a really key component. But the chef, the chef from Italy in my practice, when was she sick? It must have been in April. And she really lost her sense of smell. And she was very acutely aware of that because she uses her taste and her smell. And she couldn't taste and she couldn't smell. And it was really concerning to her. And now, what are we, 3 months later? 4 + 3 is 7. Yep, July. And I've seen her recently within the last couple of days. She told me she's beginning to regain this, right?
Wow, that's great.
To regain this. And so she does a lot of, because she really values her sense of taste and smell, she does a lot of cleanup of these areas. And obviously she's smelling all kinds of different, identifying and discriminating between many different types of smells, but she's also doing all kinds of restore. She does restore intranasal. She does silver intranasal. She does a lot of things to keep her airway clean. So, but she is now improving 3 months later, which is a benefit for her.
And I had a patient number 2 in our community that lost her sense of smell right away. And this is 2 months ago. And she has a blessing. She actually can only smell pleasant smells. She can't smell people after she can't smell the bathroom after people use the toilet. And that was actually a blessing for her. But anyway, it did affect her sense of smell. Now, there's ACE2 receptors along the pink. Those are the epithelial lining of the nasopharyngeal area that are attacked by the virus. And so we're going to talk about how to rehabilitate that. But basically, only 12% of mildly symptomatic COVID patients reported persistent loss of taste and smell a month later. So over 80%, almost 90% will regain that. And that's a good thing. And about 2 out of 3 people who get COVID lose their sense of taste or smell. So if this happens to you, we need to talk about 3 aspects. Number 1 is safety. Make sure that you have smoke and natural gas detectors in your house, and watch food expiration and nutritional intake with your foods, because you can't smell rotten milk, for example. Next slide. Okay, the second part that we want to talk about is how to retrain those nerves. And it's just like anything else, like physical therapy, like what your chef is doing. But the JAMA article, the Journal of the American Medical Association article, said to exercise your sense of smell. So you can use aromatherapy. They specifically says use rose, lemon, clove, or eucalyptus for 20 seconds in each nostril twice daily for greater than or equal to 3 months. So just practice your sense of smell with different scents. And I think what you said was your Italian chef is actually just doing this. And so she's starting to get it back.
Well, it's so good because all of these things that we need to identify through our sense of smell and taste, those are going to keep our olfactory nerves healthy anyway. And then also our taste of smell. We want to explore, we want to practice, we want to train that so that in the future we don't end up with problems. I think it could really, if you don't taste, you're really not hungry a lot of times, and you're eating and you're not having the pleasure and the benefit of all of the good nutritious foods that you can enjoy the flavors of. So we should be having a variety of different types of scents, SCENTS, that we're smelling and keeping our airway healthy and our nerves healthy. I think it's really important.
And this is kind of tangential, but I'm just looking at this picture and I'm thinking, we talked about barriers to the castle wall in our guidebook, and Argentine silver is what you mentioned. Using silver intranasally to protect your nasal passages, that's a really good idea. It's like fortifying your immune system. So anyway, about rehabbing your sense of smell, aromatherapy, 20 seconds twice daily. And next slide. And we just talked about omega-3 and how important it is for nerves and brains and mood and everything else. And so here it is again, recommendations for systemic or oral omega-3 high dose. We just spent last week talking about that, but also intranasal in the nose, vitamin A. Vitamin A helps heal the epithelium or the lining, but it also, vitamin A for eyes, etc. But it's a good nerve adjunct as well as it helps heal the lining of the nasopharynx. So that's what the JAMA article said.
Yeah, and sure. When we think about vitamin A, it's a fat soluble vitamin. And when we think about it for eyes and the way that it works in the eyes, it works very similar in the whole central nervous system. And when we, as physicians, as docs, we think about the cranial nerves. There are only 12 cranial nerves. And the olfactory is, one of the most important. And it's really important to just continually practice keeping alive all of the different functions of each nerve, whether it's the nerves of the eye, the ophthalmic nerves, or the olfactory nerves, or the nerves of taste. And vitamin A will benefit all the nervous system. And omegas, it's just really hard to explain to people how important omegas are. They are so fundamentally important. And even we were talking from other realms this weekend, Dr. Akey, about the importance of the cell membrane and these anti-inflammatories and their barrier function. It's mind-boggling. Let's just say it's awesome, like awe-inspiring. And I just think that you can't go wrong with omegas. And whatever way you can get them, if you're vegan through the algae or whatever way you can get them, you need to get omegas into you, all different kinds.
Yeah. So cranial nerve number one is the olfactory nerve. And so like all the other nerves, nerves actually rely on the cell membranes need fat, and the fat comes from things like omegas. And so it's so basic in terms of your overall health. As well, we talked about it actually stimulating the actual immune system army. So not only is it important in fortifying your immune system, it's important in healing your whole body or healing your nervous system, specifically in this situation, cranial nerve 1 or the olfactory or the sense of smell nerve. Next slide. So we also have aromatherapy offerings. I like doTERRA myself, but basically these are the ways you can sniff and practice your cranial nerve 1, practice your olfactory, your sense of smells, and use different types. Next slide. That would bring us to Q&A. Let me just look at the chat. Meanwhile, Nicole, you can look at last week's leftovers. We have just a couple of minutes. Okay, go ahead.
A couple questions have been sent in, and we have time for a couple. Someone wrote in, I have vascular problems along with a strong possibility of endothelial dysfunction. I have found articles of studies being done on nitric oxide inhalation therapy as part of a COVID treatment in hospitals. What's your guys' opinion on it?
They're using that in Boston. It's one at the Mass General, which is a hospital here in Boston. That is one of the particular treatments. It's a photodynamic therapy as well. And they are prophylactically even inhaling it in the hospital staff. And then they're also using it to open up blood vessels. And there is a supplement that I think is exceptional that works like nitric oxide. There's nitric oxide and then there's endocalyx. And if you're from Florida, Dr. Iki is well versed in both of these things. So if you have endothelial dysfunction, you probably want to do both of those.
Yeah, so EndoPro was developed by Nathan Bryan, who studied under the PhD who got the Nobel Prize for finding nitric oxide. So EndoPro is actually used in premature babies to open up their arterioles to their lungs. It's actually on our Get Healthy website if you're interested in that. We actually, if you come to the office, we can actually test you as you spit on a piece of felt, and we could tell you whether or not you're depleted with nitric oxide. But it's really, really important that you have good nitric oxide levels. It's hard to get there by just eating beets, but you could certainly add beets to your diet to try to increase your nitric oxide.
Yeah, I mean, for sure. Actually, I think we all need nitric oxide, to be honest with you. I think we can all benefit from it, whether we have dysfunction or not. So if you have endothelial dysfunction, you feel pretty confident about that, I would absolutely supplement, because you're never going to get enough from food. And you're always going to be challenged to have adequate nitric oxide to reduce the inflammation, cause a little vasodilatation, and not close off those blood vessels. Really important.
We've been recommending nitric oxide supplementation for at least 5 or 6 years in our practice. But the three populations I've traditionally used it for are the elite athletes to increase blood flow everywhere, peripheral arterial disease and coronary artery disease patients, and then men with erectile dysfunction or women with hypoactive sexual desire. I've used it for, but now this is, to me, a good indication to really get your nitric oxide levels up.
Mm-hmm.
And that product again is called EndoPro, or we also have a product called Endocalyx, but EndoPro is located on the FIRRIMup Doctors website.
And then we have time for one more question. This one is regarding omega-3 fish oils. She asked, is it 4,000 milligrams per day? And if a person can't tolerate a huge pill, is there some type of liquid kind? If so, what would you recommend?
Lots of great liquids on the market, and you can take a teaspoon or 2 teaspoons, a teaspoon twice a day. I think that they're big pills. If people burp back, they can just put them in the freezer and that'll quiet things down. But some people, I mean, you certainly don't want to take it before you go to bed. It'll sit there a little bit, but if it's a pill. But if the pill bothers you, try the liquid. And the liquids have orange essence or lemon essence or other flavors mixed with them, so they can be more tolerable.
Yeah, the Nordic Naturals mix it with lemon essence and it tastes really, really great. The other thing is Vital Choice. The canned Vital Choice salmon for 6-ounce serving has like 5,000 milligrams, the whole day's requirement. So try to eat a lot of wild salmon. And vitalchoice.com is who we generally use for canned salmon. But if you can find fresh, non-farm raised salmon, even better. But remember the smash fish, which are salmon, mackerel, anchovies, sardines, and herring. Those are the fatty, high omega-3 fish that you can eat as well. I'm sorry we didn't get a chance to answer Sharon's questions about what are the injuries, what is the sequelae in our own practices we're seeing. I'd like to spend some time on that, but just briefly, immune injuries actually, and people that with any kind of viral illness, you can have persistent fatigue post-virus. So I've seen a lot of that. In in patient number 0, she had both respiratory syncytial virus and COVID, 2 viruses at the same time. So she's got kind of chronic lung disease, very sensitive lungs right now.
I think we should probably have it, maybe next week we should talk about that.
Yeah, okay, so let's give it an appropriate time. That's
yeah, I think our topic should probably be, for those people who have had COVID, symptomatically or even asymptomatically, what could the future look like, and what do they need to be thinking about?
Great idea.
It's a really important topic, so I think we should give it a good chunk of time and be able to answer people's questions.
Perfect. Okay. Well, I see another comment. Our FIRRIMup website's not working. They're actually working on it actively right now, so it should be up within the hour or so. But thank you for checking on that. And we'll answer the rest next week. Thank you guys for coming. Nicole, you're going to take over now?
Yep, so I'm going to go ahead and kind of close us out and go over some of our specials that we have going right now and talk about where you can buy these supplements that Dr. Akey and Dr. Kathleen just discussed. So the first one that we have here is the omega-3 by Nordic Naturals that they were discussing. Right now, we actually have a 10% off code going until the 17th of July. It's right here, FIRRIM Omega, and you can purchase it through our website. Once it's back up, you'll just log back onto FIRRIMupDoctors.com, and you'll go right to the shop tab, and you'll click on the Get Healthy link. From there, you'll be able to create your account, and you'll be able to browse our supplements and purchase anything you may like. The next supplement is the Algae Omega. Same thing, we currently have a 10% off code until the 17th. The code is right here. You can insert that at checkout. This is only till the 17th, so you don't want to miss out. You should go ahead and purchase if you're wanting to. These are the aromatherapies that Dr. Akey was discussing that she personally likes. These are the 3 scents that she specifically recommended. These are also on the Get Healthy store. This is the link right here. And they also help repair your epithelial cells in your nose and will help you gain your sense of smell back. Lastly, we have the vitamin A liquid. This also helps repair your epithelial cells and boost your immune system. So you don't want to miss out on these. These are on the FIRRIMup Get Healthy store. We can post a link on Facebook for you all to go purchase them right now. Last, I just want to talk about the July special we have going on. So if you buy our Kick COVID-19 to the Curb guidebook, the paperback or the ebook version, you'll get 20% off these 2 supplements right here, which are ultra potent vitamin C and zinc AG. Our paperback book is $29.99 and our ebook is $9.99, and you can purchase them on the FIRRIMup Doctors website. As soon as you get onto the website, right on the homepage, you'll see a picture of Dr. Akey, and right to the left of her, you'll be able to click for paperback or ebook. These are only good for 1 purchase and only while supplies last. And you can email this email right here if you want to become a new patient and take advantage of any of these deals, or if you have purchased any of the books and you haven't gotten your discounts yet. And now I'm going to go ahead and I'll close us out and I'll play our outro video and then the webinar will be over. If you have any further questions that weren't answered today or you thought of any just now, you can hop over to our Facebook page, which is just FIRRIMup Doctors, and you can type underneath this live video any further questions you may have, and one of our staff members will assist you and chat you back. Thank you all for coming, and we will see you next Thursday from 3 o'clock to 3:30.
We're so glad you joined us today. We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM doctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.